Hello, I am Vanessa Veras, and I am glad to have you in my nursing team. I am delighted to share with you a very interesting theme of how the nurses in a healthcare system adopt the National Database of Nursing Quality Indicators, abbreviated as NDNQI, to promote quality care, foster patient satisfaction, and establish best practices, among others. I would like to bring to your attention that the nursing indicators help significantly in maintaining proper workflow and effective hiring and recruitment of nurses. We are privileged to be among the key organizations in the larger U.S. that provide information on the NDNQI to impact the skills of patient evaluation during care delivery. NDNQI is a state nursing catalog that assesses the nursing care that offers yearly and routine accounts of the three indicators which assess nursing care. The NDNQI was incepted in 1998 by ANA to gather and establish information that could develop a plethora of knowledge to assist stimulate eminence of care, National Database of Nursing Quality Indicators. Scientific evidence posts that NDNQI has advanced nursing brilliance by adopting an effective source of comparative values and principles in the industry. The NDNQI indicators, as described by Griggs, 2018, entails structure, process, and outcome of the client care associated with the extent and quality of the nursing care. The structure encompasses the staff's competency with the process put into account, the patient evaluation process, work satisfaction, and the determination of the nursing treatment models and intervention. The outcome, on the other hand, is the results of patients after being administered with quantity and quality of care. Subba Singh, 2018. The NDNQI effectively helped to compare the quality procedures with those from the state, national, and regional values, particularly for the same kinds of health organization. Contemporarily, the NDNQI has been acknowledged as the supreme provider of unit-level performance information. The most ideal quality indicator to incorporate in my tutorial is the outcome indicator. This indicator tends to reflect on the patient indicators that are ascertained by the nursing sensitive, since they heavily rely on the size and eminence of the nursing care delivery. In essence, the outcome indicator put into account issues such as patient falls and pressure ulcers. It is worth noting that there are certain kinds of patient outcomes that are associated with other key aspects of medical care, but are not regarded as nursing sensitive and may involve cardiac failure and hospital readmissions disorders, among others. The reason why I choose outcome as my tutorial quality indicator is that it provides information that permits the nurses, among other healthcare professionals, to scrutinize and assess the nursing performance that is associated with the patient results. Donnelly and Kirk, 2015. Also, the outcome indicator suggests the potential quality of care, which tremendously promotes the healthcare services. Besides, it integrates important elements that entail proper patient satisfaction, self-care, and provision of quality care. It is worth noting that nurses are obliged to ensure the provision of quality care. They can attain this course by using evidence-based practice to deliver care services. With the increasing contributions to the patient's outcomes, the evidence-based practices continue to support the significance of a collaborative approach to positively realize positive care on the dynamic needs of the patients. Apart from ensuring that nurses operate within the context of professional responsibility, transparency, and eminence growth in the healthcare segment, the quality indicators are a dependable process that help them to determine the effectiveness of quality projects in the nursing field. Donnelly and Kirk, 2015. They also support incessant advancement in the nursing value and offer systematic indication for structuring the performance plan and noticing the execution value in the nursing care. It provides an inclusive approach that not only benefits the patients, but also fosters continuous progress of the nursing quality. In the interview process, it was evident that many organizations adopt numerous models to collect and gather data. Some use the management admission, billing accounts, and medical records, which are known to be the typical models of data collections employed by many organizations. The surveys sent through the mails to the members of the interdisciplinary teams were expected to be completed on time and returned. Also, the organization used questionnaires to investigate the medical records. Surveying was the most prominent method used to collect data related to healthcare issues in the relationship among the other healthcare organizations. Upon collecting data, synthesis, and understanding of information pertinent to the health record system and medical records were done to ascertain the relevance and quality of the data. Deloitte, 2017. This procedure is effective to arrive at the qualitative data. Examination and analysis of the figures and facts allow the health organization to come up with informed quantitative data. More importantly, the methods of data collection depend on the nature and amount of data to be collected. Statistical organizations are responsible for the evaluation, analysis, and compilation of data collected to break it into meaningful ideas ready to be communicated to the relevant authorities or recipients. The audiences for the data are identified based on factors such as dependability of the data to the health organization and the specific audience targeted by the data. The above data can be conveyed to the audience through magazines, newspapers, periodicals, and journals, which tend to target the relevant audience. The bulletin model is used to disseminate information to the public. The organization uses the General Data Disseminating System, GDDS, to compile a comprehensive data report to be distributed to the public. When disseminating data, factors such as convenience, fidelity, and eminence are taken into account. Nurses are charged with an important role of ensuring that information to be communicated is substantial. They should consider factors such as age, education level, the gender of the audience before making necessary communications of data to them. Evidence-based practice should guide the communication process to achieve patient satisfaction and better healthcare outcomes. The information should be cost-effective, secure, and promote quality health care. The authenticity of data to be communicated can be achieved through appropriate documentation. Views of the healthcare providers are considered to make data more relevant to the healthcare setting. Deloitte, 2017. Since nurses determine the quality of data in the healthcare context, they should be subjected to sound working conditions. This move motivates them to pursue quality care in the organization, hence attaining better health results. In summation, the NDNQI is a specialty that seeks to promote quality care and improves patients' results in the organization. While it proposes 3 quality indicators, the outcome indicator becomes the most outstanding to stimulate overarching performance and quality services to the patients. The outcome indicator adopts the use of evidence-based practice and a patient-centered approach to delivering quality care to patients. Thank you.